The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back, Shifties, to the next episode of the Shift podcast. Thank you so much for joining in each week as we continue to grow our Shifty fan base. And today, I have a new incredible guest I'm so excited to interview and just kind of riff with today. It's Dr. Brent Ridge. I am going to have Dr. Brent Ridge introduce himself. So Brent, take it away.
Oh, thanks. So great to be here chatting with you. Big fan of what nurses do and all the shifties, which I think is the most clever name I've ever heard. So my name is Dr. Brent Ridge, and I'm one of the co-founders of a skin health company called Beekman 1802. And we focus on treating sensitive skin, really looking at the microbiome and the barrier of the skin. And we use two key ingredients in everything that we make: goat milk and kindness. And those ingredients are found in the official ingredient list of every single product that we make. But my journey to becoming a founder of this company was I would say it's like a yellow brick road. Because I started out in medicine. My field of study was longevity and aging. I did a fellowship in the genetics of aging at Harvard, and was on faculty at Mount Sinai School of Medicine in New York City, and decided to work with our faculty at the time to create a new center for the study of healthy aging and the care of older patients, and approached Martha Stewart to fund that center. And so I worked with Martha to create that center. And then after we completed the establishment of that center, I went to work at her company to head up her health and wellness division. Now, this was all happening in the early 2000s. And then in 2008, when the big recession hit, my partner and I both lost our jobs in the recession. My division at Martha folded. My partner's company in advertising folded. And we had purchased this farm property in very rural upstate New York, in a little town called Sharon Springs, population 547. And we had purchased this property before we lost our jobs. And even before we lost our jobs, we had a note put into the mailbox from a local farmer who was losing his farm. And he asked if he could bring his herd of 100 goats to the farm to graze. Otherwise, he would be homeless and the goats would be homeless. And at the time, we were only using the farm on the weekends as kind of our escape from the city. And we said, sure, come and bring the goats. It's like we'll have a petting zoo. It'd be fine. Everybody will be happy. But we say that was the original act of kindness that started the company, because when we lost our jobs and we had this huge mortgage on this property that we had purchased, we had to figure out how to reinvent ourselves. And so we Googled, what could we make with goat milk? And we first started making goat milk bars of soap. And when we started selling them on our website and in some stores in New York City, we started getting these anecdotal reports from people about how much it was helping their skin, particularly people who had eczema or had psoriasis. And I thought, wow, that's really interesting. I had heard about goat milk as a traditional remedy for skin issues. People had, for centuries, taken goat milk baths. But to hear this real-time anecdotal report from people who were using our product really stoked my curiosity. And so then we just started researching the powers of goat milk. And we say those original bars of soap that we started making 15 years ago are really, and we've sold 52 million bars of that soap since that time. And that really is what has propelled all of our research into goat milk and how powerful the ingredients and components of goat milk are to help the skin barrier, and the skin microbiome.
I have to tell you, Brent, I think it's such a great story. And you said a couple things. First of all, built with kindness. And really, if you think about it, most of the shifties, but not all the shifties, are nurses, and you're a physician. And as healthcare professionals, we got into this profession because we care about people. We are kind-hearted people. And so that's one reason why I love the brand. And then you said something else. You wanted to reinvent yourselves.
Mm-hmm.
And I want to go back to that for a second, but it's interesting because I have a similar story when back at the very beginning of the COVID pandemic, and I try not to talk about the pandemic that much because I like to think of it as yesterday's news, but I'm just going to share. I got furloughed from my job as a director in academic medical center. I'd never not had a job, and I was a little lost. But within
Mm-hmm.
24 hours, I had a great friend who said, "Hey, Andrea, guess what? I'm doing this travel assignment in a New York City suburb. As everyone knows, the first wave of the pandemic hit New York, New Jersey, and that part of our country incredibly hard. And I had this amazing opportunity to go up there and literally work, Brent, 6 weeks. They said, can you come up and help in this mental health hospital for 6 weeks? It turned into 6 months. That was all the uncertainty of what was happening at the time. But every act of kindness along the way helped me shift into why I changed careers, I'm still a nurse, but I changed careers. But why I'm so laser focused on well-being and kindness and giving, and then to my hat shifting, because we have to keep shifting. Like life throws us funny things sometimes. We get curveballs. And your story, there's a couple curveballs in there, but if you can take those curveballs and straighten them out, then it's incredible. And that's how we reinvent ourselves. Can you explain or just share with the shifties? Because sometimes it's hard to reinvent ourselves. What gave you and your partner and your team the strength to reinvent when sometimes you were thinking to yourself, oh my goodness, what are we doing? Is this really going to work? How did you reinvent and stay strong or persevere?
Well, I think I always say that desperation is the best motivation. So just like you lost your job, it's the first time that you had ever been unemployed. It was the same for us in our careers, particularly in healthcare, or if you're, in a big metropolitan area like New York City, where you're defined by your career, you're defined by your accomplishments in your work. It can be really devastating personally, as well as financially and all the other things that come along with it. But desperation is the best motivation. And, what I firmly believe that everything that you encounter in life, every job you had in life, whether it was your first babysitting job, whether it was like my first job packing groceries or working in McDonald's, every job is and should be a learning opportunity. And everything that you encounter in your life, you should be able to draw from to make your next step in life. And I think that's exactly, what we did. We just said, okay, what is our opportunity? We have the goats. What can we make with goat milk? And then once we saw the benefits of it, we said, okay, how can we grow this business? How can we help more people with this business? And that's how we did it. And going back to what you were talking about with kindness, for us, not only did the company start with that original act of kindness, but I truly firmly believe that kindness is wellness. And, just like all of us, nurses, physicians, healthcare providers, we spend a lot of time talking about preventative medicine and trying to encourage people to exercise, make better life decisions, eat better. Acts of kindness are as powerful on the physiology of our body as all of those things. If you give an act of kindness or you receive an act of kindness, those things have actual physiological ramifications on your body on a cellular level. And that's why we say kindness is an ingredient in our product, because when you use our product, not only do we want you to see the immediate benefits on your skin, but we want you to be reminded of a company that was founded on kindness, and that when you walk out the door every morning, you have the opportunity through kindness to improve your own health and the health of every single person that you encounter during your day. And that's one of the reasons that we decided to partner with nurses on a recent collaboration a couple of years ago to celebrate World Kindness Day, because we had read a study from the American Nursing Association that talked about how many people an average nurse impacts per day with an act of kindness. And I think it was like 40 people per day. And we thought, wow, that's so powerful. And if that nurse impacts 40 people in his or her community each day, and then some percentage of those 40 people pay it forward and take that act of kindness further into the community, that really creates an exponential ripple effect of kindness in your own community. And it all started with that nurse. And so we wanted to figure out a way to support those nurses. So we partnered with them on an educational initiative with the Nurse Association, did a fellowship program with them, and then also worked with a group of nurses to create a product, which was a special ceramide hand cream. And again, this was coming out of the pandemic when nurses were probably washing their hands even more than they normally do. So we partnered with them to create that special product, which then fed back into the education programs that we were working on.
The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout. Increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk. That's a great story. And I know all the nurses that are listening, they're super excited to hear that kindness is truly an ingredient in your product. Mm-hmm. And then in my head, I envision, every time a nurse or a physician, even a respiratory therapist or anyone who's taking care of patients puts lotion on their hands, especially this time of year, it's made with this ingredient from your great company, but then it touches the 40 times the 4 million nurses. And just think about how that community of kindness grows and grows. And these are the things that get me really excited. So how can we shift how people think about healthcare professionals, specifically nurses, because I'm a nurse. And how do we change that mindset? Some people during the pandemic were kind of like I don't want to say anti-healthcare professionals, but they became a little cynical. There was a lot of cynicism. And so I think when I meet people like you and we have these discussions and we talk about truly the goodness, the wholesomeness, and the kindness that comes out of what your company does, what nurses, what physicians, what we all do, I think that's what makes this world a better place. And I get super excited about that.
Absolutely. And I would say, you're talking about shifting. You shifted in your career and I shifted in my career. Just because you have started out in one career, like nursing or any type of healthcare, I think it's such a great vantage point from which to start a pivot to whatever might be your interest. You may have entered healthcare because you were at a particular stage of your life and you had a certain interest or a certain set of circumstances that made you passionate about it at that time. And people's lives change. You go in different directions, different things pull you or push you. But the foundation that you have as a healthcare provider of any sort is so powerful because you not only have an understanding, at least a rudimentary understanding of how the body works and of how the mind works. And more importantly, because of so many interactions you've had with people on their worst days, their worst moments in their life, you have a fantastic insight into how the psychology of people work. And once you have learned all of those things, your anatomy, your physiology, your psychology, those can be applied to virtually any type of career. There's no career that that type of fund of knowledge is not going to be a powerful asset to. Now, you may have to figure out your sales pitch to show the person or the industry that you're going into why those things are valuable. but they are valuable.
I 100% agree. That was so well put. And I have to do a quick shout out because I'm just sitting here thinking about kindness. And Meg Skiff, who works with me at SE Healthcare, and Jillian Tice, who made the connection for us all together. I just want to send them a lot of love and a lot of thanks for making this great, meaningful connection. And then I want to shout out to Meg's little girl, Lola, who's 8 years old, who loves your product. And she had
Great.
this great story to tell. And I don't want to mess up the story. So someday I'll get the story and share it with y'all at Beekman. But I'm telling you, there's reasons why we get connected like this. And I think the connection is just to remind everybody of the power of kindness.
That's
And
right.
I had something fun. And this might be putting you a little bit on the spot, but I was thinking about sometimes when life gives you lemons, you get lemonade. And then for y'all, when sometimes gives you goats, when life gives you goats, what do you turn that into? And I was wondering if the shifties, I'm going to put some of this on social media, if some of the shifties could come up with something really, really fun when life gives you goats and make it kind of catchy. Send
Mm-hmm.
that to me on social media. I'll share that with Brent and his team, and we can do something fun with that.
I can't wait to hear the responses.
I think that'd be fun. So, Brent, thank you so much for sharing your great shifting story. And I have to tell you, I hope you have a gazillion more successful shifts in your career and the difference that you make in communities. We end each episode with giving shifties a couple golden nuggets to walk away from, or a couple golden nuggets or takeaways. So you do have anything super powerful, which I know you do, that you'd like to share with the shifties?
Ooh. Well, it's interesting because I was just having this conversation with a colleague. We have a book on entrepreneurship that's coming out later this year in July, and
Type it up for us, Brent. Tell us all about it, and our shifties will go buy the book.
it's called Goat Wisdom, greatest of all time wisdom: how to build a great business. And the idea of it is that you don't need an MBA, you don't need an advanced degree, you don't necessarily even need a college degree to build a great business, because everything that you truly need to build a great business you have already heard before. And that's what goat wisdom is. It's like all of those proverbs that you've heard before. Don't make hay, make hay while the sun is shining, or love thy neighbor. Like, these are things that you hear all the time, and actually you hear them so many times that you actually don't give them a second thought. And what we try to say in the book is, hey, when you hear a piece of tried and true wisdom that way, that has been repeated for hundreds, sometimes thousands of years, just take a step back and think, well, what is that actually trying to tell me? Because if it's been around for thousands of years and passed through every culture around the globe, there must be something to it. That must be the foundation of which I can make a decision or make a career change. And so that's really what the book is about. I was talking to a colleague about the book, and we were talking about the fact that we have gotten so far away from listening to what people say to us. And if you don't first start by really being a good listener, and I know a lot of healthcare providers and nurses are good listeners by virtue of their careers, but if we don't start by being good listeners, then we're not going to, one, ask the next follow-up question, right, to clarify, and we're not going to have curiosity. You have to be able to listen so that you can ask the right question, and you have to be able to listen so that you become more curious about the next thing. And so that's what I would tell people, to just practice those skills. And I know, by virtue of our careers in nursing and healthcare, we do this anyway. Really listen. And when people say something to you, believe them. If people are telling you something, believe them until you can prove it otherwise. But you can't prove it otherwise until you ask the right question.
Oh, you just gave so many words of wisdom, so much goat wisdom. I love it. It's so ironic. A couple of things you said are so ironic. First of all, you mentioned bagging groceries, which was your first job, and I bagged groceries. Then you said working at McDonald's. I worked at a Burger King. So this is really funny. And then you talked about goat wisdom, and you don't have to have an MBA or a DNP or a PhD. And a really great, brilliant friend of mine, an incredible human, Jason Andy, I'm going to shout out to him. We were talking about the power of goat wisdom, entrepreneurial spirit. So it's all ironic that we're having this discussion today. And then I think one thing I want to say is a true act of kindness is really authentically listening to somebody.
100%. You can't do anything more kind than saying, you know what? I am present enough in this interaction, in this situation that we are in, to be listening to what you say. And if we think about it, we're so often distracted by the world, by social media, by everything going on around us. We often don't listen as much as we should, or even as much as we think we do.
Wait, so I have a 21-year-old and 19-year-old, and this was a few years ago, but I would go to their sporting events when they were in high school, and then they'd come home and they'd talk to me about it, and they could see me on my phone. And my son called me out one day and said, "You didn't hear one word I said." I said, "You're right, Finn. I didn't." Because even during this interview right now, I don't know about you, but I have messages coming across my screen, my phone's going off, and we've created such this society that it's hard for us to listen, and we're taking away that kindness. We're robbing ourselves and others of kindness by not listening.
That's 100% correct. And even if I'm just going back to my time on the medical ward, and I know it's even more complicated now than it was then. When you go into a room to talk to a patient, likewise, you're so distracted by so many things in there that you actually probably don't listen as well as you could or as well as you should. And think about all of the things, not only in the patient interaction, but just in your life, all the things that you're missing out on because you don't take the time to listen.
And you miss out on so many things you miss out. So I have to tell you, Brent, this is a great nugget takeaway for all the shifties listening. And with that, I'm going to thank you one more time, Brent. I hope that at some point you'll come back. We can get you back on the show. And the other thing I want to say to all the shifties, remember, your shift makes a difference. So keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.